For us, patient-centered care is the cornerstone of our organization. We strive to achieve this through teamwork and innovation, as well as high-level education for our trainees. We focus on the best care for our patients, of course, but we also try to do this by testing and implementing new technologies so we can further advance medicine.
Patient-centered care means thinking about what makes each person unique and using everything you can to put their needs first. Children are the best example of one size does not fit all. Providing an optimal perioperative care in children is a multidisciplinary task. We are very lucky that we work in an academic setting and hospital where you have several facilities to take care of children adequately and with no delay. There is sufficient monitoring of all kinds, and there is a large experience and expertise in pediatric anesthesia. There is also a very good backup from neonatal and pediatric intensive care for those children who will need sophisticated postoperative care and monitoring. There is also availability of performing procedures such as endoscopy, MRI, radiation, etc., or interventions such as a CT guided biopsy under anesthesia or sedation outside the operating room with experienced anesthesiologists. And I'm very proud to admit that all facilities for a safe pediatric anesthesia practice are available in my institution.
Innovation plays a very important role in our organization. We try to be one of the first hospitals to implement and test new technologies so we can be the first to help our patients in a better way. The hybrid room is a theater where we perform complex cardiac and vascular surgeries. It is equipped with state-of-the-art hemodynamic monitoring technologies for us to monitor our patients in the best way possible. The cath lab is a place where our cardiologists perform their more invasive procedures such as coronographies, also rhythm surgery and valve replacements. For us as anaesthetists, it's essential to provide the best monitoring for these patients, since these are often patients with a lot of comorbidities.
Surgeons historically have been trained in a different way than anesthesiologists had. Our training is based on competence, self-belief, trying to get the best outcome out of the patient. It's quite an optimistic view on treatment, whereas anesthesiologists prepare for the worst case scenario, have a slightly different view on risk assessment. And so these two worlds collide at a certain point. And so we need to find a way to bridge this half full, half empty mentality in order to assure patient quality of care. And at the University Hospital of Brussels, we have been quite successful in achieving that by a collaboration based on mutual understanding and respect for each other's expertise in the service of our patients. We have now established training modules where anesthesiologists are involved in the postoperative care of patients, surgical patients in the medium care or high care or even in the ICU setting. Surgical residents are also involved in anesthesiological care. So basically, by collaborating from the start in our training, we establish a collaboration for the future that is fruitful.
We try to provide our residents with an excellent training. We try to use the blended learning approach, so we both use in-classroom teaching as bedside teaching, as well as simulation training, and also some digital forms of teaching. Simulation for us is one of the main pillars of resident training. We try to use it once a week. We do high fidelity reanimations, which means that we have a reanimation mannequin that we can intubate, that we can resuscitate, we can place IVs, it can talk, and we do different type of scenarios. It's very important. We not only practice technical skills, but we also place a great emphasis on non-technical skills, teamwork, leadership, communication. That's also very, very important to us.
I'm in my 4th year assistant here in anesthesia training. It was a very personalized training with the residents and attendings were very close. You got a lot of feedback. A lot of the time one-on-one training. The attendings are really personal with you. You get feedback every day. You get a train every day. They let you do everything if you feel comfortable doing it. So it's a really nice, safe way to learn anesthesia.
I believe that anesthesia will change over the coming years. We will see more and more complex technologies using AI and such to help us. I believe that technology, however, will never replace us. The anesthetist will always be present next to the patient to support them through difficult times.